your input on how do you manage your mental health or in terms of stress through the mental angle.
I will say the most important thing when it comes to stress in women as they get older is to find the right partner. If you're not married well, you cannot manage stress. This
Good.
is something that I've learned over the years. So I'm very grateful I have a fantastic husband.
Mm.
So I think that's half the thing. Like a lot of times when you have a very supportive family, you have less stress. But in general, when I get stressed, one of the things I do is I actually go quiet.
Mm.
I'll take some time to figure out why am I stressed. I actually write things down on a board and see how do I handle
You
this.
do?
Yeah,
Ah.
because you know there are, this is one of the things I used to go to a lot of these motivational talks with Tony Robbins. He will say you should always have three options for a problem, and after you find the three options, find a fourth one. So it's like I always keep that in mind. Whenever you have a problem, there is always a solution. You just have to figure out what is the solution which has the least amount of what do you call uh,
The input
downside to
downside.
it, right? Because sometimes the problems can always come, and the solutions can come with their own problems.
Great.
So you have to sit down and solve the problem. What I find most people tend to do is they talk about their stress over and over and over again,
Mm.
and then they're rewiring their brain to talk about their problems, but they never talk about solutions. So there's a rule: you talk about your problem once, and that's it. After that, you only talk about solutions. But if you keep talking about the problem all the time, it becomes more than it is.
Wow.
So that's something that I've learned over the years.
When you say talk about like talking to yourself,
Talking to everybody,
everybody.
whoever they call, they'll say, this
I'm
happened, that way.
overwhelmed.
Yeah, I'm overwhelmed. This is what is happening. My work is like this. It's so
Mm.
toxic. They're constantly talking about it. What are you doing about it?
Mm.
If your work is a problem, change.
Ah.
You have that job because you have some skills. Move.
Mm.
Don't stay in a place and keep talking about it. I mean, to me, first of all, working is a privilege. Not everybody gets a job. And when you
Mm.
get a job, don't complain about it, make it work for you.
Mm.
I know it's easier said than done, especially when we see in medicine the burnout of doctors and nurses.
Great.
But I always tell people if you've identified that your job is a problem, change it. Do something. Either you change your attitude towards your job or you change your job. But
Mm.
don't keep talking about it.
Mm.
Then, if you're talking about it like with your friends, your family, and everybody, it just has become a big problem that you feel is not surmountable at this point because
Mm.
you've made it so big, right? So I think don't talk about a problem more than once.
Wow. I'm so glad that I'm talking to a medical doctor about these kind of issues because this is the main thing that is actually making the patient not getting better.
Yeah,
And I always feel that, especially a patient walks into my office, any GI problem, there is always an underlying stress issue.
always 100%. In fact, when a woman comes in with multitude of problems, backache, shoulder pain, migraines, guaranteed she's not having support in her life.
Mm.
But you cannot bring that up unless they're willing to talk about it.
Mm. But you practice in the US and you have seen Indian setting as well.
Yes.
You will be the best person for me to ask. You see a lot of divorces
Hmm.
and marital
Yeah.
problems among
Discordia.
the white Caucasian family. Uh, is it getting common? It is getting common among Indian community as well.
Hmm.
What a person listening to this podcast, what should they actually work in case, let's say, that the marital support is not there or they want to work on it? Have you seen any patients like that? And just a thought on that.
Yeah, I really think this is a conversation, right? Many times in the Indian community, unfortunately or fortunately, it may be an arranged marriage, so you
Mm,
had no choice in how you found your partner.
mm,
But I think a lot of times, the kind of people I meet are a little more educated.
mm,
We do have these conversations.
mm,
It's almost the same inertia
mm,
to make the change,
mm,
right? Whether it be going for counseling,
mm,
That's another thing, a big taboo in the Indian community,
Yes.
going to a psychologist or therapist. But
Mm.
it's also getting better. I feel
Mm.
like more people are open to therapy.
Willing to, yes.
Yeah, willing
Mm.
to
Mm.
go. And I think you have to first make that decision. Do you want this to work? And if you've made that decision that you want it to work, then you do everything within your power to make it work. The problem is people don't know if they want it to work. They don't make decisions. I think
Mm.
the indecision is the biggest problem I see in life. So when you identify a problem, first of all, make a decision that you're going to solve it, and or you want to solve it. Sometimes you might be like, oh, this is over. This doesn't work for me on any level, and that's okay too.
Mm.
And then you make that decision. And I always tell my patients, create a plan for an exit if things don't work. But if you decide
To be in there.
to be in that
Mm.
relationship, make it work.
Mm.
Figure out a therapy session, talk to your spouse, involve some friends, but try to make it work. Most of the times we tend to withdraw and become silent
Mm.
and just live in that toxic environment. And I
Mm.
think that manifests as diseases in us.